Hi everyone, today we are going to show you how to properly measure your blood pressure. We're going through really times that we don't know what's going to happen in the next months or weeks even. So we want to be prepared for our obstetrical patients. We still have to do prenatal visits. It's not something where you can come when you don't feel good. There's a lot of things that we do that we can try and prevent any complications. And so if we decide or if your obstetrician decides that your prenatal visits are going to be more spaced out, we want to make sure you know what to watch out for and how to measure your blood pressure. So today this is our office, and so this is our staff doors. I'm going to show you how to measure her blood pressure, but at home you don't have a machine like this. Typically you buy machines that your local pharmacy, and either it's on your wrist or it's on your arm up here. So either one, we find that it's still more accurate on your upper arm, but then sometimes that's hard to find. But if you're using one, just use it consistently and try to check at the same time every day, either in the morning or at night, or both if you have higher risk. And also if you don't feel good, you definitely want to check it. But the most important thing is what to do with it after you check, and knowing what's normal and what is not normal and when to call the doctor or go straight to the hospital. So the proper way to check your blood pressure is having your arm be at the level of your heart. So if your heart's right here, that's kind of where you want to be. You don't want to be measuring it like this or like this, because those are not going to be very accurate. And you want to be in a kind of relaxed and resting position, such as what Doris is doing. So we're going to measure her arm on that side. And measuring it with the right cuff is important, although you don't really have that much choice in a commercial blood pressure machine. But here for her, this is a pretty regular size for most adults. So this is the artery that we're trying to capture, and measuring a blood pressure is someone's pressure in their vasculature. And so we gotta put it where her blood vessel is. Okay. And you don't want to be having a conversation, especially a very excited one. When we're doing that, you want the patients to relax in their resting mode. When you just come in, you're very excited, and you sit down, your blood pressure can be a little bit high. So always a good idea to kind of sit there for a good 10 minutes, 5 minutes at least, and then check the blood pressure. So we're gonna check. They have blood pressure machines at Walgreens and CVS that you can also go to, but then it's just kind of inconvenient to go there weekly, and also at this time you try to stay at home, so just get a blood pressure machine. I think that's easiest. You can probably get it in any pharmacy or probably on Amazon. I'm sure they have some. And it's good to kind of measure it. If on one side is very high, check your other arm and write it down for your doctor. So the critical numbers that we look at in a blood pressure in a pregnant patient, hers is pretty low because she's young and she's a female. So her blood pressure is 86/55. For the top number is called systolic. The bottom number is diastolic. And so there's always two numbers with your blood pressure. So if your blood pressure is greater than 140 on your top, that systolic, that is high. On the bottom, if it's greater than 90 for your diastolic, that's considered high. So in a pregnant patient, we're especially important to watch out for high blood pressure, because you may not have any symptoms. And as a young reproductive age woman, you normally don't think that you're going to have high blood pressure, and then you're going to kind of miss that cue. So anything above 140 or over 90, they don't have to be both, one or the other. You have to call your doctor or go to the hospital if you cannot reach your doctor, or if you're consistently getting that number. So remember, more than 140 or over 90. What's considered too low? Everyone's blood pressure is very different. So my blood pressure is probably going to be very close to Doris's. My blood pressure is probably running about this much. And every gestational age, which part of your pregnancy, will determine if your blood pressure is going to drop a little bit or remain kind of on your normal. So if she doesn't feel dizzy, lightheaded, then that's pretty normal for her. But if she always lives in the 130s, 140s, and now it's this low, she's not going to feel very good. So normal blood pressure can range pretty widely, but we don't want it to go high, especially during pregnancy. So again, in a resting state, measure, write it down every day, keep a log of your blood pressure and check at the time that it's normally when you check. And if we're going to send anyone to check blood pressure at home, it's either because your blood pressure is already high and we want you to monitor at home, or in special circumstances like now, we may be having patients check at home to minimize the number of prenatal visits so that they can safely monitor their pregnancy. So in either one, if your blood pressure is greater than 140 or over 90, you definitely need to call the doctor. Don't freak out immediately. Rest, take another one, that's okay. You can take it on the other arm, but then call your doctor so that you can know. And also, we did a video on how to dip your urine. That's the other thing you need to do as well, is you want to check your urine. And this seems like a lot of things, but you know, any question, call our office if you're our patient, or call your doctor's office so they can tell you what to do. Okay, so good luck everyone and be safe.